Thank you very much. Hi, everyone. Let's get going with some of the provincial numbers. As you know, we've been kind of going upwards a bit. Now we're at, we increased to 1699, 1700 or so from the previous day. And over the last couple of days, we've been really at the 1800 mark moving forward. So, it's going higher. It's plateauing there, but a bit at a higher level. Again, pushed mostly by GTA area. 85 cases in Ottawa, and we've had our share now. We've had a long weekend. Our staff have had issues with where we are here with increased cases, as you may have noted. Over the weekend, we actually added 71 cases, 24 in Cornwall, 30 in SDNG, and 17 Prescott Russell. Now, some of these were related to outbreaks. The Cornwall ones related to some of the outbreaks, and but a lot of these in SDNG were just close contacts at home as well. And so this brings us up. Our rolling average is really now in the red. We kind of skipped going into the red next week, but if this is a situation that continues, we're obviously going to be put in the red next week. I'm going to be looking at that, and I'll also be looking at other things. Like, for example, now we've got quite a few hospitalized patients, including 6 in the ICU, and we've got 8 outbreaks at this point in time. So, again, our positivity and our positivity hasn't changed much from last week. Our R naught hasn't changed much from last week, but again, we're going to keep that, and this is what's worrying me now. Among those, 95 of those cases, and we will be putting them at some point, are VOCs in our area. And just to give you context, last on the 15th, our 7-day average of percentages was 38.6. In our latest one, it was 43.8%, which is almost the provincial average right now of those numbers in terms of the outbreaks, the cases due to VOCs. In terms of some of the other things that are going on, obviously, among our outbreaks, again, the PALIS seems to be stable with 2 resolved cases among residents and 3 also resolved of staff. Again, just waiting to complete our final testing round before hopefully that's declared over. Chartwell, McConnell Manor, again, we've got 13 positive and 12 are active, and there were VOCs there. Again, in terms of the staff, 13 from the 13 staff, right now 9 are active, and 7 out of 13 were VOCs. And again, we're working there as well to ensure that all the precautions are in place. We've had the remainder of our outbreaks really that are listed on our website in long-term care facilities, obviously, have been no residents, just staff in these, and so we're working there to make sure it's maintained. And again, that's a stark contrast. Again, most of the outbreaks that we've been getting, and provincially as well, since we vaccinated, the residents have been really minimal in terms of the residents, and really almost exclusively due to staff being positive in those areas. We do have, again, latest numbers are from the Hawkesbury General. We have an outbreak there on a ward where there's 3 positive staff and 8 patients, and again, they're VOCs as well. And I just want to say that sometimes we get a couple of VOCs in a cluster, and I assume they're all VOCs. What happens is they need to have a certain amount of antigen load in the tests, and some of them don't have enough to be able to do the mutation test. So where they do the mutation test, and it makes sense if there's a cluster, they're all VOCs. It's just that we don't pick them up on the laboratory in that regard. The schools, again, we've had 30 cases. In 25 schools, we've added since the 18th. We've added 1, 2, 3, 4, 5, 6, 7 cases in that one, and among 25 schools. And right now we have 3 cases among our daycares, but no outbreaks there at all. One of the things that I'd like to say is, like I said, over the weekend, our staff were quite busy, obviously, with having to follow up 71 cases over the weekend, and required a lot of follow up and so on. I just want to sort of share with you some of the experiences that our staff have been having, and not only at the local level, but also across public health units in Ontario. We recognize that people are frustrated, but we've got increasing number of cases. We've got to call people, particularly with the concern of the VOCs. Our staff who have been doing contact tracing have been yelled at, screamed at, abusive language, swearing, and so on to them. And our staff literally sometimes are in tears because they've been so rudely spoken to, hung up on, abused, like I said, sworn at, vulgarities, like the civility is gone. And this has been experienced across the health units in Ontario. And I'm pleading with people, our job, they're trying to protect everybody. They're doing their job. They want to follow up. They want to, if you're positive or if your family's positive, they want to make sure that we protect everybody else around our community. So they're just doing their job. They're trying to protect us. So please be a bit more polite to our staff, please. They work hard. They work 7 days a week. We're also pulling them to do vaccines. So I'm just pleading there. I've actually, I've been on other media and I've talked about this. I've actually texted the premier, and he responded to me by voicemail actually because for some reason I couldn't take a call, and told me that this was unacceptable and he would be addressing it. So I'm hoping he's going to address it as well. But this is something that, again, I'm pleading with everybody. Please, they're just doing their job. I wish they did not have to call you. Over the weekend, we had to make those initial 71 calls to do the contact tracing and see where things are. So I wish, so the lower the numbers, the less we're going to call people. But again, they're just doing their job. And please, try not to be, try to cooperate. Recognize everybody's tired. I understand that everybody's fatigued. I think that at this point we really need to just be a bit more patient and like I said, hopefully, what I'm also worried about is that we're going to be going into the red zone likely early next week, or if I see it going up like this over the next couple of days, we may even have a talk with the ministry to do a earlier red zone. You also know that with the red zone, there's been some changes that primarily affect restaurants. In orange, restaurants are allowed to have 50 people, obviously maximum 50 people. In red, they were up to only 10. Because they wanted to have an equality with other retailers, which were based on our percentage, the government has now changed that. And for red, it could be up to 50 people, again, based on size and ability to, put people, distancing, and 100 in orange. And again, that's more people going in. So that the difference now is that in red it was like orange before in terms of the number of people in restaurants. Everything else has really not changed in those categories. But one of the things that came up though, which I'm happy they included in the regulation, is that individuals who go to a restaurant and sit at a table, and there's limits, I think there's 4 per table in certain zones, red and orange as well, those should be from the same household unless they're caregivers to one person. So I think that's an important modification that was made. So now I want to turn to vaccines, and we've had a busy week. We've had multiple clinics going on over the weekend as well. We have one today in Winchester as well, and they're flowing well. As you know, the announcement was made last week that now we're vaccinating people 75 years of age and over, and so as of this morning, the system was changed to be able to offer appointments to people who have had vaccines basically who are 75 and over. And so we've had, however, some issues. Again, this is due to the ministry issue. For some reason, some of the clinics were not accessible to people. I heard that about Hawkesbury. We have now put a report, and we've actually been on the phone all day with the ministry. Some of our appointments were not, again, we're missing. In Winchester, in Cornwall, one of the clinics was missing as well. In Glengarry Sports Palace, again, one was the age-based clinic was missing. Hawkesbury as well. Rockland, there's a screenshot that comes up when you want to book an appointment, and it comes up in red, and it said, if an appointment time is not responding, the time slot is booked, and then please do another time, but it won't give you another time, so it won't allow you to book. Again, these are we brought them up with the ministry once again, and hopefully they will be resolved. I just want to reassure people that we have already booked at this point almost. Almost 10,000 people. That's what we were counting on. We had estimated that would be a number, and that will, and we have increased capacity in the clinics moving forward to do even more. So now we've added the 75-year-olds, and so it's important that people. And then sometimes what I want to tell people is sometimes it's booked. And all they got to do is click and go to the next month. Some people don't realize that we have clinics in there in April. Obviously, in April is in a couple of weeks. So you can actually, if you see, so people, if you have a hard time and if you see there's no appointment, try just going to the next month, and you'll see there's more appointments opening up. Like I said, we've got multitude. We've got 37 clinics in there between now and April. And what we're going to do as well, because we're doing them in big areas purposefully. Now that we've opened it up to 75 and more, and we do know what the numbers are across the province and across our area in terms of how many who are in what age group in what area. So we do our expectations. So what we've done is, in order to accommodate the 75-year-olds moving forward, we've actually going to, because our clinics are very big, we're going to be adding more vaccination stations now to be able to accommodate more people at those given clinics. So moving forward, that's what we'll be doing. We'll still be receiving the allocation that we talked about last week in terms of around 4,800 a week through to the first week of April. We should be hopefully getting new projections of our allocation moving forward, probably in the next couple of days. Now, some of the things that we also want to remind people on, and what we've been seeing is, please verify the clinic location at your appointment, because sometimes in a certain area we might have two. So make sure that you know in which clinic it is, which address that you've booked for. The other thing too is the appointment, the booking system, provincial booking system does not remind you that you need to have a consent form. And so what's been happening is people have been coming without the consent form filled out, and we have to fill it out on site, and it just adds to the timing. So please, if you've booked on the provincial system, if you book on our system for pre-registration, you will be prompted to it. But I spoke to the ministry about it, and there should be a click at some point when you book a system when you book an appointment in the provincial system, that you can actually have a link directly to the consent form. And also, please just arrive 5-10 minutes before the appointment. We've had some lineups in certain areas that were due to the fact that people were showing up an hour and a half earlier. I know people are anxious. I think it's very good to get their appointment, but please just come up, be there about 5 minutes before so that it can flow. For the most part, all the clinics were flowing very well. And so up until today, right now, we have vaccinated close to 20,000, including what we'll be doing today. I know we've got something like 19,400 on our website. So we're almost 20,000 vaccinations, and we're going strong moving forward. So there's enough vaccine for everybody. Like I said, now we're opening it up to the 75-year-olds, and please be a bit more patient. Again, we do have slots. It's for some reason that they don't appear in there, and we will be able to accommodate everybody, and hopefully move to the next phases, as soon as we possibly can. Donc, je vais commencer avec les chiffres antérieurs. En effet, aujourd'hui, on a augmenté de presque 1700 cas. La plupart autour de Toronto, Ottawa avec 85. Nous, dans notre région, on a pas mal aussi, on augmente au niveau de nos cas. Cette fin de semaine, nous avons ajouté dans nos cliniques. Nous avons ajouté des cas, 71 cas cette fin de semaine, 24 à Cornwall, 30 SDNG et 17 Prescott Russell. La plupart étaient reliés au flambé ou au contact de flambé. Au contact des flambées. En effet, c'est toujours, on était un peu déçus de voir 71 cas. Aussi, vous pouvez voir au niveau de la moyenne mobile ici qu'on est vraiment nettement dans la rouge actuellement. Donc, je m'attends que si ça continue comme ça, on va être mis dans la zone rouge la semaine prochaine ou avant, dépendant le cas et dépendamment les autres chiffres qui, à ce moment-là, n'ont pas changé. Le pourcentage de positivité et le taux de réduction sont à peu près quand même stables à ce moment-là. Parmi les cas, nous avons 95 qui étaient de variantes. Le pourcentage des variantes est à 43,8 %. C'était 38,6 % il y a quelques jours et on approche la moyenne antérienne. Donc, à un moment donné, ça va être à peu près, ça va être la plupart des cas qui sont les variants qui sont beaucoup plus faciles à propager d'une à l'autre personne. Au niveau de nos flambées, on continue à avoir, je pense qu'on a 8 actuellement. Il y a juste quelques-unes qui ont les résidents positifs. Le Palace avait deux résidents et trois employés. Maintenant sont résolus, tous les 5. On est en train de juste faire le protocole pour qu'on puisse finir le flambé, déclarer le flambé fini. Chartwell, McConnell Manor, on a 12 actifs encore sur les 13 qui étaient positifs au niveau des résidents et on a des 12 sur 13 qui étaient positifs pour la variante. On avait 13 employés et 7 sur les 13 étaient positifs pour la variante. Donc, 9 sont actifs actuellement. Donc, on continue avec les précautions. Au niveau des autres flambées, je peux vous dire que c'était exclusivement dû aux positivités au niveau des employés et non des résidents, qui est une bonne chose. Et je pense que ça, c'est dû au fait que nous avons vacciné tous les résidents et tout au niveau des maisons de retraite et longue durée. Au niveau des écoles, nous avons ajouté 30 cas pas ajouté, on a 30 cas en total dans 25 écoles. Nous avons ajouté 6 pendant la fin de semaine. Donc, j'aimerais juste parler un petit peu que cette fin de semaine, c'était une fin de semaine très difficile pour nos employés qui appelaient les personnes pour faire le suivi de contact, le tracé de contact avec des positivités. Et en effet, ça fait quelques semaines, et non seulement dans notre bureau de santé, mais à travers de l'Ontario, que nos employés reçoivent, sont pas bien reçus, si vous voulez. Ils accrochent, ils donnaient ils sont pas plaisantes. Hein. Le personnel qui reçoit les appels ne sont pas contentes et ils sont méchants. Ils sont vraiment méchants à travers de nos employés. Et ceci, comme je dis tantôt, c'est une chose qu'on voit à travers d'Ontario. Donc, je vous prie, s'il vous plaît, nos personnels font leur job pour nous protéger de façon collective. Et moi, la meilleure chose, nous espérons qu'on n'a pas besoin de vous appeler mais une fois que vous êtes positif, on doit vous appeler pour faire le contact, pour limiter la propagation du virus. En effet, ça, c'est un rôle qu'on joue. Et s'il vous plaît, ne pas être fâché et s'il vous plaît, être un peu plus plaisante avec nos employés qui, des fois, ils pleurent à cause de tout l'abus qu'ils ont reçu. Donc, ça, c'est s'il vous plaît. Ça, c'est une demande personnelle que je donne à la public pour vraiment être un peu plus doux avec nos employés qui travaillent fort 7 jours par semaine. Maintenant, on va tomber au niveau des vaccins. Je peux vous dire que dès aujourd'hui, on a ouvert les vaccins aux personnes de 75 ans et plus. Nous avons encore les problèmes avec le système d'Ontario. On a eu quelques cliniques qui n'étaient pas mis, malgré que sont sur la liste, ça n'apparaît pas dans les outils provinciaux. Donc, on est en train de travailler avec le ministère qui puisse arranger, qui puisse le régler. Il faut dire que nous avons assez de vaccins pour tout le monde. Jusqu'à date, nous avons booké 9 000, presque 10 000 personnes. Nous avons espace pour plus. On a vacciné quasiment 20 000 jusqu'à date, doses de première dose, en effet. Et on s'attend d'avoir assez pour les semaines prochaines. Donc, s'il vous plaît, découragez-vous pas. Juste, ils vont le régler bientôt. Donc, on aura beaucoup de cliniques. On a 37 cliniques en total à travers de notre région. Et qu'est-ce que nous allons faire dans chaque clinique? On a la capacité d'augmenter. Donc, étant donné que nous avons ajouté les 75 ans et plus, nous allons ajouter des tables de vaccination. On a beaucoup de place. C'est pour ça qu'on a choisi des grands, comme des arénas, des espaces comme ça, pour qu'on puisse augmenter le débit au niveau de vaccinateurs qui sont sur place. L'autre chose que j'aimerais juste souligner, c'est que, s'il vous plaît, vérifiez l'emplacement local de la clinique, parce qu'on a quelques cliniques, on a 2 locales, et des fois, on ouvre un, et puis des fois, les deux apparaissent. Donc, s'il vous plaît, notez l'adresse qui est sur la liste, qui est sur le bordereau de confirmation. Et aussi, apportez votre formulaire de consentement rempli. Ça va nous aider, ça va aller plus vite avec ça. Malheureusement, le système provincial ne vous donne pas, un rappel de le faire. Ça va être réglé bientôt. Mais en attendant, si vous avez un rendez-vous prévu, vous allez juste aller sur notre site web, vous pouvez trouver le consentement que vous pouvez télécharger pour remplir avant que vous rentrez. Ça va être plus vite avec ça pour nous. Et finalement, n'arrivez pas que 5-10 minutes avant votre rendez-vous, s'il vous plaît. Cette fin de semaine, on avait beaucoup de personnes qui attendaient. Ils étaient là 1 heure et demie avant le rendez-vous. Donc, on ne voudrait pas avoir les lignes, surtout à l'extérieur. Mais la plupart des cliniques étaient très facile. Ça a très bien allé avec tous les cliniques. Donc, juste avec ces petites choses, en attendant, comme je dis, on se mise sur le débit que nous allons recevoir d'ici la deuxième semaine d'avril, et d'ici quelques jours, on va recevoir pour le mois prochain. Et donc, à ce moment-là, on va augmenter le débit, et puis là, on va commencer avec la phase 2, dépendamment des vaccins qu'on va recevoir. So I'm just going to answer some questions here. Question was, were there problems about the 75? I've talked about them. Were there last minute appointments made? Yeah, what we do is we have last minute appointments when we have extra vaccine, because what happens is once we bring the Pfizer vaccine to a second place, if it's opened and if you don't use the dose, you lose it. So what we do is we have people on our created lists that are healthcare workers and so on, that we can call in to do that. So will the eligible vaccination age drop by 5 years on a weekly basis? No, well, I'm not sure about how frequently we're going to drop from one to the other. I do know that, I know what the age group, I know how many we have. I mean, just in our area, we have 18,070 to 79, and we have about 9,080 plus. So it'll take maybe a bit longer to go through the 70, 79s than we did to 80, the 80 plus, but it will be based on what we're seeing, based on our numbers, and so we know what the projection, we know how many we have. It's a matter of how many vaccines we get, how quickly we go those slices of 5 downwards. And when will the Winchester area be shown as a location option? It is there. Again, I explained it before. It's a mistake. We have Winchester. As a matter of fact, we're there today. So the system doesn't show it. There's a question about cumulative numbers. Bill, what I'm seeing is we have 3063 as cumulative total on Monday. On Friday, and adding it today brings us to 3134 because we added the 71 cases. So anyway, that's where we are. We added 71, and based on what we had 30, 60, 63 on that's what we show that we had last week. And then another one here says, I read that I'm confident that we can get the first dose by June. Yes, if we have enough vaccine and we're able to progress, yes. So that all depends on the vaccine. I'm optimistic about that. That's it, Jenna. If you have questions now from the media.
Yes, thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul.
Hi, Philip.
South Dundas saw an increase of 10 cases over the weekend and currently has 22 active cases. Are these all clusters, like a known epi-link, or are these?
Some are household contacts. I remember there was, I'm not sure if it's South Dundas, but I'm glad you brought it up. There were a couple that were outdoor social gatherings, and just to show that sometimes if you're even close outdoors, you can get it. So a lot of these are household contacts.
Okay, and do any of them have to do with the asymptomatic testing that took place in one of the elementary schools in South Dundas this weekend?
No.
No. Okay.
No,
and
they were all part of our own outbreak follow-up and positives. No.
And you said the indications are that the way our numbers are going, especially the rolling 7-day average, it puts us in the red. Will you be recommending to Dr. Williams this week that we should move into red?
Unfortunately, yes. Okay. I have no choice. You saw the numbers.
Yeah. Okay.
Unless we get a miraculous decrease over the next couple of days.
Okay. Thank you, Dr. Paul.
Okay.
Prochaine question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul.
Bonjour, Denis.
Évidemment, il a fait beau en fin de semaine, comme vous l'avez probablement constaté, comme tout le monde. Bon, les gens en ont profité en grand nombre pour aller prendre un verre sur une terrasse, par exemple. Malgré tout, avec la présence de variants beaucoup plus contagieux, la situation sanitaire est toujours délicate, même qu'elle se détériore, comme on a pu le voir. Oui. Dans un contexte comme celui-ci, c'est quoi le message que vous désirez communiquer aux gens?
Merci, Denis. Le message est qu'on est dans une période très, très fragile à ce moment ici. Ça prend vraiment les précautions. À la limite, là, on ne peut pas lâcher les précautions de tout parce que sinon, on va continuer à avoir le débit qui va augmenter et on va être forcé dans zone rouge ou pire. Ça ferait dommage parce que de notre côté, on voit qu'on commence à vacciner plus de gens et espérons qu'on va vacciner beaucoup plus de gens. Donc, le plus qu'on fait attention et le plus qu'on laisse le vaccin faire son travail, si vous voulez, le mieux qu'on va être. Donc, c'est très important de continuer vraiment de respecter les mesures de 6 pieds, les masques, etc. Surtout quand on voit dans notre région presque 43%, 44% sont des variantes qui sont beaucoup plus faciles à transmettre d'une personne à l'autre.
Dr. Paul, dernière question. Vous êtes fait poser la question plusieurs fois au cours de la dernière année. Êtes-vous inquiet des Québécois qui continuent d'affluer de ce côté-ci de la frontière, que ce soit pour aller dans les magasins ou dans les restaurants, même que certains se louent des chambres d'hôtel en raison du couvre-feu toujours en vigueur au Québec?
C'est toujours un problème. En effet, on ne voudrait pas avoir des personnes qui ont des problèmes à Québec, beaucoup plus des cas que nous, en effet. Oui, ça m'inquiète, mais je peux vous dire, Denis, que dans le restant de notre région, c'est pas le cas de Québec qui donne les éclosions et le problème que nous voyons.
Merci beaucoup.
Pas de problème.
Next question, Bill Kingston, Newswatch Group. Please go ahead.
Yes, hi, Dr. Paul.
Hey, Bill.
I wanted to ask you, first off, St. Lawrence College came out today and said that they are planning for in-person classes this fall. Given the age bracket of people that are going to college and the way you're seeing the vaccine rolling out, do you think that's overly optimistic?
I think it's optimistic, but perhaps not completely unrealistic. We have been, the dean has contacted me, actually the dean from all the campuses, telling us that. We think it's a good idea to plan how you see it. I don't see them going back like fully normal. There's going to be some precautions. It'll have to be depending, as they're going to be, for most part, they're adults. They can be vaccinated, number one, and number two, it depends on what the rate of herd immunity is and what the rate of transmission is in the community. So I told the dean, I told him that, you know, it's a good idea to plan, but I don't think we should be planning for a full return to school as normal. That's for sure.
Okay. And my follow-up is your sister health unit to the west, Leeds Grenville, is pausing some of their services like breastfeeding, sexual health, and immunization clinics for 3 weeks to pull those people off to do contact tracing and vaccine rollout. What's the staffing position like here? Are you in a position that you might have to do that?
Yeah, as a matter of fact, yes, we've already the exception of certain high risk healthy baby, healthy children's programs, which we want to continue. It's going to be all hands on deck for as much as we can to be able to vaccinate. What's discouraging the bill is the fact that ordinarily we'd have them as more vaccinators, but now they have to do contact tracing because of the 71 cases that we had. So that's why it's important for us to be able to match that, to be able to make sure that we optimize our ability to vaccinate. So yeah, we have to as well, all hands on deck.
Okay, it was muffled a bit. Did you say all your programs except for the
Most of our programs are now on hold. We continue our vaccination program, but that's going to stop as well. The only one that's going to continue, actually, we have to restart or just a very little, our healthy baby, healthy children's program, which we had put on hold. But the ministry has asked us to just look at the high risk to ensure that we at least have some contact with high risk families who've just given birth.
Okay, thank you very much.
You're welcome.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul. Can you hear me okay?
Yes, I can.
Okay, wonderful. I have a question. Will second doses need to be completed before outdoor gatherings of more than 100 will be reviewed, or will children need to be vaccinated before outdoor gatherings sizes reviewed too?
I think the first question is actually the second question is easier. I don't think we're going to rely on children yet because they're not vaccinated yet, and I'm not sure when they would be. So I think that's not going to be an issue. I think more the first one. I think that there's going to be, that's what we're looking at. As you know, the CDC guidelines are doing it for second dose, like after second dose. If we have enough people vaccinated first dose, we know that there's going to be a high level of immunity, and depending on the numbers, I can envision a period where we can increase progressively some of the outdoor gatherings and indoor gatherings, but not to normal. I can see that happening as we approach higher levels of herd immunity, even based on the first dose and looking at the numbers. So I am optimistic that we might be able to increase those numbers, but we're not going to have going to arenas to watch a hockey game, for example, 20,000 people. So I think we might have an increase. Again, that's something that we're looking at provincially, trying to see, what's the best timing and what's the best approach to start, loosening some of the restrictions when a certain percentage of the population increases. The question is, to what degree are you comfortable doing it when first dose has been delivered versus second dose? So I think there's some degree, but not as much as I would with second dose.
Okay, thank you so much. Have
You're
a great
welcome.
evening.
Thank you, you too.
Next question comes from Thomas Stockton, TVC 22, who asks, with this large spike in cases over the weekend, what would you say is driving this increase? Is it people being too relaxed with their health measures? And how do you think these modifications to the restaurant numbers will affect the number of new cases we are seeing?
Well, that's a good question. I think what we're seeing here, most of it is household contacts and some social gatherings and workplaces as well. But what happens is one person goes home and then three get it at home, and that's the multiplier effect, which we've always been seeing. So yes, the restaurant increase to me, if it's done properly, if a restaurant and people who go to the restaurant can be, it's a family only. They wear the mask. They take precautions when they go to the bathroom, wear the mask all the time. I think it will be fine. I just want to make sure that that's one of the reasons I had sort of said before that I was happy that they had put now an obligation to ensure that the people sitting together are from the same household. Because the last thing you want is people eating together who are not from the same household, and that's going to be a disaster. So I think that at this point, if it's done carefully and people take heed in that, fine. Again, this was done, I believe, because the restaurant businesses were saying, well, look, why is another retailer allowed to have a percentage of people based on capacity, whereas you have like a strict limit to us, which is like 10. particularly in red, and 50. That's why it came from. So they're trying to balance it. So it is a tricky balance in between. So I'm hoping that people can adhere to those measures. And again, I keep telling people, if you absolutely go out and eat, fine, but please limit your outings as much as you can. It's only a matter of time. We're getting there.
Do you have any more confirmed vaccination dates in Clarence Rockland beyond the 15th of April?
Not at this point. We're resetting them right now. We go a month at a time based on our numbers, but there's going to be more. I guarantee you, there's going to be more. At this point, we only have booked that far ahead because that's how many vaccines we had. So we knew what we can plan for. Certainly, there's going to be more, of course. But as soon as I get them, that's what I was saying. As soon as I get the numbers, we'll be able to then plan the next. It'll be month by month moving forward.
And also from Thomas Stockton, TVC 22, though you have answered this before, with many 75-year-olds saying they can't get appointments, why aren't there more vaccination clinics in the region at the moment?
Vaccine supply. I'm only getting 4,800 a week. Do the math. We've got just between 80s, the 80-year-old population between 70 to 79 and 80, you're looking at close to 30,000 people, and I'm only getting 4,000 vaccines a week. It's just a mathematic issue.
Thank you. Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you very much. Merci.